Here's what fresh air does to us, and this is what's really exciting, is that when you think about taking, say, a special action to protect us against the current pandemic, you wonder, well, if it is effective, so we don't get it, how do we know that we would have gotten it anyway and that all this effort, all this potential cost wasn't in vain, that we really didn't need to do it? Well, these guidelines that I'm giving you, you're going to experience a return of whatever costs you put in that's going to occur regardless of COVID. That we should be doing these things. There's a number of us that have been saying we should be doing these things for decades. That is doubling airflow from the level that's the current building standard. And those of you familiar with like ASHRAE standards, 62.1, 62.2, the title of those are adequate airflow. And these are odor-based ventilation, not health-based ventilation standards. So these are standards based on only making 20% of a building's occupants dissatisfied with the air quality. And this is not healthy air, and you cannot smell healthy air. So a study by Dr. Milton, who you've seen him perhaps on TV, he's been on CBS and other national broadcasts. He was one of the co-authors of the letter to CDC and WHO saying this disease is airborne, co-signed by about 300 other scientists and epidemiologists around the world. This is airborne. We need to take this seriously. Well, he's been working on this stuff for decades, and you'll find lots of papers on various types of airborne contagions. But just studying over 3,000 employees scattered among dozens of buildings, he found that by doubling the airflow per person from about 20 CFM to 40 to 50, that sick days were reduced among 3,000 employees, a sizable number, by 40%, the same effectiveness as the flu vaccine. And the value of that 40%, roughly 1 day of sick leave per person, about $500. So a number of folks, next slide please, Cassie. So a number of folks might be wondering, well, what's the cost of that? We're going to double that fresh airflow. Now we have more conditioning needed, summer and winter. And in Illinois, for those of you here, we have the worst climate in the country. We have those Arctic blasts from Minnesota and that heat and humidity from New Orleans in the summer. So we've got quite a range of conditions to prepare for. Well, telling you that going to 40 CFM to 50 CFM per person, which is more than double of what most buildings are at now. And the simplest way to know if you're at that level is by measuring CO2. And if there's one thing out of my part of the talk to get, is to get a CO2 measurement instrument. They're $150 to $200. You can carry them around, share them, map out your building, map out your home, take them to restaurants and motels. You'll be surprised at the range you see. This tells you absolutely how much fresh air has been added through ventilation as well as infiltration and construction flaws. You'll have about 1,000 to 1,200 with about 20 cubic feet per minute per person, 800 ppm of CO2 is about 40. And it escalates. When you get to 400, you're outside. It's infinite airflow. The concentration of contagion is 0. You're very unlikely to get sick outside unless someone sneezes on you. 500 is very high, and for sure you don't want it too low because then you do start having excessive energy costs. Next slide, please. This is just a plot using something called the Wells-Riley equation, but it is for determining the probability of getting sick. And again, by Dr. Milton in another study, when he was at Harvard, that CO2 coupled with the time length that you're in a space determines the probability of getting sick. As CO2 goes up, the fraction of air that you're breathing that came from someone else's lungs goes up, and the fraction of viral particles that were in an infected person's lungs go up, until finally it's highly probable you're going to get sick. Next slide, please. And here is the same plot, but translated a little differently in different cases that I've run. The upper red circle are current household ventilation standards, but with people wearing masks inside a home. Without wearing masks and without good filtration, but at current ventilation standards for a home, which is somewhat less than 20 cubic feet per minute per person, you're over 90% going to get sick. And indeed, studies have shown that 80% of a group of 7,000 people who were traced and tracked for COVID infections, that 80% of the transmission occurred at home. But that other 20% that occurred, outbreaks that occurred outside of the home, these involved up to 8 to 9 people per infection. And this leads to the conclusion that one person goes out that's infected, infects maybe 8, 9, 10 others in a public gathering place, shopping or restaurant. They go home and infect 2 or 3 others in their home. And that's one person leading to about 30 infections. That's how simple it gets transmitted when we don't wear masks, when we don't distance, when we don't have concern for others. When we take these guidelines and double the fresh air, improve filtration, as well as then add ultraviolet, we can drop down to 1/3 of the chance, a very substantial reduction. And what happens with virus transmission is that when you get below a certain level, it will decay on its own and snuff out. But the US, unfortunately, has been bouncing around above the decay limit, and we've been unable to snuff this out as so many other countries have been able to do.